Welcome back to Radiology Made Easy. Today we have another fascinating case to test your diagnostic skills. Let's jump right in. Our patient is an elderly woman who has experienced a fall and is unable to bear weight on her right hip. Let's examine the initial imaging findings. Take a look at this radiograph of the pelvis. Notice the heavily calcified arteries and osteopenia, with no acute bony abnormality. Pause the video and examine the image closely. What do you see? Great. Now let's move on to further imaging. Here we have coronal T1 and T2 weighted MRI images. Notice any irregularities? Pause the video again and take a closer look at these images. Excellent. I think you have made some observations. Now, let's put all the pieces together and see the findings. In the MRI images, observe the irregular focus of abnormally low signal intensity on the T1 weighted image and high signal intensity on the T2 weighted image. This extends across the intertrochanteric region indicated by the arrows. What do these characteristics suggest? Pause the video and come up with your own differential diagnosis. What do you think this could be? Great observations. Now, let's consider the differential diagnosis. Our differential diagnosis includes a non-displaced incomplete intertrochanteric fracture, an insufficiency fracture, and metastasis. Given the patient's presentation and the orientation and location of the derangement in the MRI signal, a non-displaced incomplete intertrochanteric fracture is the most likely diagnosis. Insufficiency fractures favor the femoral neck, and the patient's history of a fall and the intertrochanteric location are not characteristic of this entity. Metastasis is also less likely due to the lack of lobular mass-like morphology, typical of metastatic lesions. Excellent. Let's delve into some essential facts about this condition. Non-displaced, incomplete intertrochanteric and femoral neck-hip fractures following a fall from a standing position are common in elderly female patients with osteopenia. The outcome of these fractures tends to be better if the fragments are not displaced. MRI is crucial for diagnosing these fractures when plain radiographs are inconclusive. Isn't that fascinating? Before we wrap up, here are some pearls and pitfalls to remember. If a hip fracture is strongly suspected in an osteopenic patient with normal radiographic findings, limited coronal T1 and T2 weighted MRI is efficacious. Characteristic findings of a fracture on MRI include irregular, low T1 weighted and bright T2 weighted signal intensity. Occasionally, T2 weighted sequences may not adequately characterize the fracture due to surrounding edema contusion. Keep these tips in mind. Thank you for joining today's case discussion on Radiology Made Easy. Keep practicing and you'll be well prepared for your exams. Stay tuned for more cases in our series. Until next time, happy studying.